larger crater like such, but we have filled it in and it is healing quite nicely. Over here, this also was a large crater which we were able to bring together and make this fine line rather than a big dip. Okay, let's come back to the center here. It looks like we are going to be treating 1, 2, 3, 4 craters today. 4. Now, the way that we are going to do this is by injections. We have our medicated injections here. There is 1. There is 2. Here is the 3rd. And we have 1 more. Here is the 4th. Now, what we do is sometimes we do not need to create a laceration on the skin. We can just inject. I'm thinking that this crater here, we should be able to inject from the external side. Now, these larger ones, such as this, I can feel it is quite deep and very tender underneath, almost, I don't want to say rotten, but kind of rotten, and it feels very mush. So we are going to make a small incision and inject into the tissue. The incision will be micro, very, very little, and we will be able to then insert some triple antibiotic medication and apply a small gauze patch. This will not be a deep, deep cut, so we will not need to suture today. I want to begin with this one here. So I'm going to attempt to inject this and bring it back to a plump state, flat and appealing for this patient. So what I will do is I'm going to move these. And I'm going to clean off the areas in which we will be injecting. Okay, now that this is sterile, we will take our first medication and start injecting. Okay, so what I'm going to do is just press down a little bit on the skin here, and from the side we are going medication is doing its job. We just have a much smaller indent now. Let's put the remainder of this medication in. Perfect. And now we will clean that off one more time. Let's cap this needle. Perfect. Safety first. Make sure you never take the cap and try to put it onto the needle. Scoop works best for the non-retractable needles. Let's go ahead and clean that up a bit before we move to the next spot. Much better, just a slight bruise now. No more big crater. Perfect, perfect, perfect. Okay. Now we are going to move to this lump right here, or I should say dip, 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 dip. A lump would be up, this is a dip. And we are going to attempt to fill this one as well. Though it's a little bit bigger in diameter, it's not quite as deep as this one. So let's see what we can do here. We are going to take this and let's remove that lid. Perfect. I'm going to just apply a little bit of pressure like last time, and we are going to inject and fill. Okay, let's go ahead and clean up a bit. Okay, minimal bruising as well. Much, much better. Let's move on to the next two craters. Okay, so for this crater right here, we are going to take a 10 blade and make a very small nick in the skin. About that big right here. Okay, and we are going to inject into that. Let's give a little bit of pressure. Yeah, nothing in there. It is just empty. So let's go ahead and inject and see if we can't plump this back up right here. We will be using this syringe right here. There's 2.5, a little bit more than 2.5 ml. let's go in and up a little bit. Just like that. And over here, I'm going to come to the side a bit and go at a downwards trajectory. Perfect. Now let's get the cap for this needle. And let's clean that up a bit. I will hold just a bit of pressure, and I'm going to do a circular motion just to help spread that medicine around. Perfect. After we finish the last crater, we will come back and patch this. So let's find our last area. Oh yeah, right here. Okay. And we will do our absolute best to get this looking as good as possible. We will again make an incision for this one using our 10 blade. We are going to go across horizontally right about here. Perfect. And again, let's squeeze. No, doesn't appear to be anything in there again. Okay, let's inject. It looks like it's kind of a lopsided dip, slanting to the right. So we are going to try to fill in from right here to about right here to get the best fullness effect. So let's try that. I'm going to go to the incision that we made. And now we will place this bandage. And let's do the other incision. Okay. I'll put the antibiotic on first, and then the bandage. The other two areas we filled, we are not going to bandage or put on the antibiotic, as we don't have these larger, deeper incisions. They will be okay. Alright, let's try